Hello.
Good morning, everyone.
Good morning. I hope you are well.
Mm-hmm.
And I hope you can hear me.
Yenn saay ci samay bés yu neex sama xel dem ca fama jóge woo yenn saay sama xel dem ci nit ñu baax ñamu séqaloo ngir mënoo fàtte ki la yaataloon ki la ma yoo on nous jamais namanale namanale ale manu yok yeah. Yenn saay ci samay bés yu neex sama xel dem ca fama jóge woo yenn saay sama xel dem ci nit ñu baax ñamu séqaloo ngir mënoo fàtte ki la yaataloon ki la ma yoo on nous jamais
Good afternoon, colleagues. Good morning, good evening, wherever you are. We want to welcome you to our webinar this afternoon. We've given some time for a few colleagues to join, but I think that we have the numbers to start now. So please, I'd like to hand over to the moderator to take over. Thank you.
Thank you so much. My name is Abaneh Ebangwese. I am currently a PhD student at the University of Maryland, Baltimore, and I will be your moderator today. Thank you for joining us, whether it's good morning, good afternoon. I know people are all over, so again, welcome. I want to start with our first presenter, Dr. Adejumo. I'm going to introduce her and then she will go ahead with her slides. So Dr. Adejumo is a certified global nurse consultant and fellow of the International Academy of Addictions Nursing, who works to promote equitable access to preventive health services in the United States and abroad. She believes integration of evidence-based preventive care is vital to individuals in substance abuse treatment, considering their ongoing physical, sociological, and economic issues resulting in decreased life expectancy. Therefore, knowledge sharing, best practices can enhance health promotion and help bridge the gaps in prevention. In 2019, she was instrumental in facilitating the formation of the International Nurses Society of Addictions in Nigeria, the first chapter established in the continent of Africa. Working with this group while collaborating with other international chapters, she was fortunate enough to have contributed to the third edition of the Addictions Nursing Scope of Standards. Through INT-NSA, she continues to maintain relationships with Nigerian nurses in psychiatry, schools of nursing, governmental agencies, ministries, and professional organizations. Likewise, she remains in continuous dialogue with representatives from West African College of Nursing, the African Union Commission, the United Nations Office on Drug and Crime, representative for Nigeria, and the International Society of Substance Use Professionals. Dr. Adejumo is a transformational leader and active promoter of the Integrated Diabetes Prevention Program, especially within substance use populations, and is thrilled to have collaborated with AfriHealth. She believes this partnership is a significant step towards promoting global health and the vital role of nurses in improving global healthcare service delivery systems. Thank you. Dr. Adejumo.
Thank you, Abaneh, for the introduction. Thank you so much. So again, welcome everyone to today's webinar on evidence-based nursing practice and drug demand reduction. This webinar, like she said earlier, is going to be recorded and you will all receive the recordings later. I will discuss drug demand reduction in the first presentation and later discuss the nursing professional involvement in drug demand activities. So to start, the epidemic of substance use disorder is rising exponentially across the globe and in the African nations. So thus the aim of this webinar is to improve the overall health outcomes of individuals with substance use disorders in Africa. As you know, substance use disorder are associated with continuous use of substances such as alcohol, tobacco, and psychoactive substances. And that in that case, right, the objectives for this webinar, at the conclusion of the presentation, the participants will recognize the global risk associated with increasing prevalence of substance use disorders, reflect on their role as leaders to take a critical stand in drug demand reduction, and apply basic process to influence a change in minimizing complications associated with substance use disorders or in substance using populations. So for the background, what brought us to this point? Why are we here today? It's important for us to know that substance use disorders are associated with continuous use, like I discussed before. They are not only illicit drugs. Substance use disorders include substances such as alcohol, tobacco, and psychoactive substances. And one of the huge or major or primary characteristic is continuous use of these substances, despite the adverse effects. And what that means is that the individuals engaged with substance use disorders have diminished self-control. When we're discussing about the substances, we are not just talking about one. Sometimes it may be one, it may be multiple substances combined together. Some of these substances are traditionally accepted in some societies and in some communities. So I've discussed earlier that alcohol is also one of the substances that we are included in substances of use or disuse of abuse. Tobacco and other illicit drugs, both prescriptive medicines and non-prescriptive medications are included in there. With this slide, the rate of use is becoming a global public health problem, and that's the reason why we're here today, to figure out what nurses can do or what clinicians can do to help mitigate the use, and so that we all can have healthy communities, healthy global communities. The rate of use in Western Central Africa is about a little higher compared to the rate of use in other parts of the world. Why is that? Because cannabis, as you can see on this slide, is locally grown in most of the African countries, especially something like Nigeria. In the World Drug Report of 2023, there was a 23% increase in the use of drug use disorder, which includes about 29 million people. In the drug report of 2024, we can see there's a reduction, a little bit of reduction, but there's still a lot of ways for us to go. If you look at the percentage dropped from 23% to 20%, which shows that all the activities that we're doing, that people, clinicians are engaged in, is working. So this is not the time for us to relent. Cannabis is the highest of the drug of the substance being used all over and in African nations, followed by opioids. Then the other thing I want us to pay attention to is that in Africa, compared to the rest of the world, has one of the highest amount of use, or prevalence of use. If you look at this slide, 2010 to 2020, Africa still remains the highest amount of, with the highest prevalence of cannabis use compared to the rest of the world. If we also look at the socioeconomic issues in Africa, we wonder, why is it that cannabis is used a lot in Africa? What is causing the problem with the excessive use compared to the other nations, especially in countries, in nations that have gone through a lot of political, socioeconomic issues? And preventive treatment is very, very limited in the continent. So why is it that it's still having the highest use or the highest prevalence of use? So this is something that I would like for us to think about as we're going through the issues we have in drug use, and also how we can help to mitigate or help to engage in activities associated with drug demand reductions. So substance use disorder is linked to not just the people using the substances, it's linked to so many issues. It's linked to poor and economic or legal and health outcomes. As you can see on this slide, adverse effects of drug use can lead to liver disease or liver damage. It can lead to heart disease. It can lead to breast cancer. reproductive issues, mental complications. So as we're thinking about how we can mitigate the problem associated with substance use disorder, it's always very, very important for us to also think about the consequences associated with it too. Some of the substances are associated with like physical health problems like pre-diabetes and type 2 diabetes. Type 2 diabetes can lead to heart diseases. So we wonder why a lot of our young people, like in the middle 50 years or less, are having premature death. The life expectancies in the African nations are very, very low compared to all the other nations across the globe. So we need to start thinking of how we can do the mitigations. What about the use of substances among the women? As we can see right here, we have a lot of issues, not just for not for regular other people or men. Women also have some problems. If we look at the complications associated with substance use disorder among women, it has a lot of them. We have ectopic pregnancy, miscarriages, victimization, stigmatization, poverty. Then it's not just the women it affects people across the lifespan. So we have fetal effects too, stillbirth, fetal alcohol spectrum disorders, small head circumferences, especially with the use of cocaine, low birth weight and length, prematurity in birth, irritability of the newborn, sudden infant death syndrome, and reduction in executive functions. This is how it affects us all. We have a child from birth has all this problem, and then when they grow into the adult age or adulthood, what do we expect them to be, and how do we expect to help them with this issue when they've already been exposed from the fetal stage? So now the question is, what can we do as clinicians without knowing the etiology of the disease or how substance use disorder occurs? It will be very, very difficult for any clinicians to help with the mitigation. So the first role in us as clinicians, regardless of whether we're nurses or we are social workers or we are any kind of health discipline, in anyone in health care disciplines, it's important for us to know the models of attributions. The long-term model was the moral model, and that discusses about the failure of an individual or weaknesses of an individual. That model is not an evidence-based, so we don't use it anymore. Educational model indicates that if somebody doesn't know about it, they are likely to use it. Spiritual model, maybe because they have weaknesses or low spirituality. Personality model discusses about someone maybe because of their personality attributes. That's the reason. That's what is leading them to substance use. We have conditioning model. We have the socio-cultural model. The one that is most of the evidence-based that people that is really evidence-based and is current right now is the dispositional disease model. Shows that substance use disorder is a chronic disease, just like we have type 2 diabetes, we have other chronic diseases, non-communicable disease, classifies substance use disorder as a chronic mental disease. And then we have the public health model and the biopsychosocial model. Some models also, the biopsychosocial models, also lead it or attribute it to some sort of genetic predispositions. So as we're looking at this, right, we need to start to think, which one of this model can we use to establish our arguments when it comes to with mitigation or mitigating substance use disorder? The trend in Africa is disturbing. And as I said earlier, there's so many articles. This is one of the World Drug Report of 2020 that indicated that cannabis is grown locally in Africa. A lot of people are using it as teas. They are putting it in their in making food with it without the knowledge of the consequences associated or the potency of cannabis in and how the damage or the consequences that can be associated with it. So education is very, very important, and that's one of the reasons why we have this webinar today for us as clinicians to not just relent. So, everywhere we are, at any point in time, we need to educate our patients about this use and the consequences of use at later in the early age or early stage and at later use. Now, the question that I want to pose to us is that what can nurses do? Why nurses? We are the most prevalent of all the healthcare professionals across the globe. We have more nurses, more than medical doctors. We have more than social workers. We have more nurses than pharmacists. So looking at the way we were taught as nurses using the assessment, diagnosis, which are now changed to analysis, planning, implementation, and evaluation, it is important for us to start thinking of our environment and how we can influence change in this environment. It can start a little, it doesn't have to be big. So clinical judgment, we want to ask patients, influence changes in patient safety. We want to encourage communication with our patients. We want to assist with the problem solving, because mitigation of substance use disorder is not just something that is easy. It's a complex problem that needs to be addressed by every stakeholders, including the patient, and it must be patient-centered. We want to engage and learn about the ethical dilemmas that are associated with substance uses. We also want to collaborate. We want to collaborate with others. We want to collaborate with other nursing, other people, other professionals, because nurses alone cannot do it. It has to have other members of the healthcare discipline working together to influence a change in our society and in our community at the global level. So at that note, the last but not the least is thinking about integrity. Integrity, what I meant by that is that when we ignore or we decide that, oh, this is not my problem, it's the society problems, then that's not an ethical issue. I mean, that this is a failure of ethics in nursing. We must be ethically sound. One of the code of conduct in nursing is that nurses must be able to provide equitable access to prevention for our patients. And the beginning of that is looking at the issues in our community with substance use disorder and helping to mitigate those issues all around us. So thank you. So this ends the first part of my presentation, and I'll stop sharing.
Now we're going to open up the Q&A. If there's any questions, give like roughly 5 minutes to answer any questions on this presentation. You can either put it in the Q&A or you can raise your hand. Well, if there's no questions now, you can still put questions in the Q&A and we can address those. But we will go ahead and introduce our next presenter. Our next presenter is Dr. Reychad Abdool. He is a national of Mauritius and a medical doctor and public health specialist. He joined the United Nations Office on Drug and Crime in 1999 and retired as a senior regional drug and HIV advisor in Kenya in 2015. During his career, he worked in 50 African countries and in the Middle East in several capacities. He has a wide experience in public health, policy formulation, advocacy, country situational and needs assessment, strategic and program development, implementation and evaluation, national drug control master plan development, capacity building, and research. He is a master trainer in drug use prevention, drug dependence treatment, and HIV prevention and care among people who use drug in prison settings. He has strong leadership and negotiation skills and is a strategic thinker. Dr. Abdool acts as a senior independent consultant to the African Union, the European Union, and the Expertise France AFD Group, Ministry of Europe and Foreign Affairs France. Let's welcome Dr. Abdool. Thank you.
Thank you very much indeed. And good afternoon from my part of the world. I am sitting in Mauritius in the Indian Ocean. So it is the afternoon, late afternoon. So good afternoon or good morning as it may be. From the names, I understand that many of you are in Nigeria, perhaps also in Ghana and other places. For your information, my first trip to Nigeria was in 1990 to Benin City at the University of Benin. That was a long time ago. So I don't want to use any slides. I just want to have a chat with you. And I have, I'm focusing on the subject of reflecting on your roles as nurses and leaders to take a critical stand in drug demand reduction. First of all, I think you are such a blessed profession to care for people, to prevent disease, to alleviate pain. And you are therefore ideally situated in order to intervene in the realm of drug demand reduction. By definition, DDR is a spectrum of interventions that spans from prevention, early identification, all types of prevention, such as in schools, in communities, in the workplace, among families, FBOs, sports club, young people, young women, etc. Treatment starting with psychosocial interventions, as well as pharmacotherapy, and going into recovery, aftercare, and relapse prevention. And it goes on, social reintegration, professional reintegration, etc. I look at you, I am assuming that most of you are from the nursing profession. I look at you at two levels, general nursing and psychiatric nursing, not, of course, forgetting the other cadres of nurses that you have. Number one, in the area of prevention, you can bring a significant contribution, whether it is preventing the onset of the use of drugs or identifying it at an early stage, and then you intervene. And same thing in the school, you are already very busy, but there is a lot that you can do in prevention in the different spheres of prevention. Two questions that you have to ask yourself. What is it that what I can best do given my training and my profession? And number two, always interrogate yourself. Am I doing the right thing? Is it evidence-based? Is it science-based? All the time, please keep these in mind. In the area of treatment, again, treatment goes through many stages. But when I look at the profession, I am thinking especially of SBIRT, meaning screening, brief interventions, treatment, to a certain level with counseling, whether it is basic counseling or advanced counseling, and referral to treatment. Plus, you also can play a significant role in relapse prevention, aftercare, and recovery. I would think that you have a special role to play for women who have started to use drugs, who are using drugs, and pregnant women as well. Because in antenatal care clinics, you may come across several young women who are using alcohol or cigarette or drugs without really thinking that whatever that they're consuming is having an impact on their bodies and on the fetus that they may be carrying. So in antenatal care, when we talk of brief interventions, this is an intervention that can last anywhere between 5, 10 to 20 minutes. But there is a small trick that I can give you that in antenatal care, you can have a brief intervention in less than 30 seconds, simply while the woman is undressing and getting on your couch. You have just taken her history, you are chatting with her, and you say, by the way, Mary, or so-and-so, by the way, have you consumed any alcohol in the last 4 weeks? Now, depending on her answer, it could be no, so there is no problem. It could be yes, and then you say, but do you know that every drop that you are consuming is actually having the same amount is being consumed by your baby in your womb? So start this discussion, this conversation in this way. In the emergency room, many people will come to you if you are in an ER, whether the victim of a traffic road accident, whether it is cuts and wounds and blows, and other type of trauma that you may, after taking care of their immediate urgent needs, if there is some time, you can engage in a short conversation, or you can ascertain whether this trauma, this road accident, was a result of the use of alcohol or the drugs. And if you don't have the time to take care of this person at this point, you may refer him or her to another service. For those of you who have training in psychiatric or psychiatric nursing, you can also do a brief intervention, and you can also do some diagnosis in terms of psychiatric comorbidity, because we always use the term, again, chicken and egg situation, whether it is a psychiatric problem that brings addiction or substance abuse or vice versa. I think there is a truth in both ways. It depends on situations. So you also have, for those who have training in psychiatric nursing, that you can bring a contribution to provide some basic counseling and then to do referral. Not to forget that you can also play a big role because you are first responders. You are in face-to-face with this clientele on a daily basis. You have also a large role to play in research. And from your research, feeding into your practice, feeding into a global community of research where you can play a significant role in advancing the science, in advancing your role as nurses, as leaders, in order to make a situation better. Now, I won't go into the diagnostic tools or even the screening tools, simply to mention one which I particularly like. It's called the WHO Assist. It used to be paper-based, but now you have the electronic format, and I can tell you it's a beauty to use, because paper-based, it used to take about 40 minutes to administer it. With the electronic format now, you can administer it in 20 minutes. So I would really encourage you to have a look at this. And for diagnostic tools, also there are many from the DSM diagnostic tools to WHO and others. So in a nutshell, one thing to keep in mind also is, do not think that you can do everything. No. You need training to do anything you want, but you need training to do it well. Do not venture simply with your good heart to say, I can tackle this. You cannot. I started doing this work 42 years ago. I started alone. Short time later on, I realized this is not something you can do alone. You need to have a small team. And the more you have a good team, well-trained. 42 years ago when I started, no internet, no email, no literature. I had to write to people in Switzerland or elsewhere to get literature, and if I get a reply, it will be after 3 to 4 months. But today, with the advent of the internet, everything is at your fingertips. That's why I wanted to have this face-to-face chat with you. Nigeria is a country I know very well. I was in Ghana last year. I have worked in many of your countries. I do understand where you stand. And from my point of view, therefore, please identify where you are best, where you can bring a significant contribution, get into a team instead of working alone, put your strengths together in order to make a difference, and train yourself, please, because without training, and I just saw Sharon Berder's a few slides, and I was quite intrigued by the subject matter that you're going to deal with. So I'm going to listen to you very carefully. Please, please, please train yourself. But again, you have massive amount of information. Make sure on the internet, make sure that you are looking at the good information, because there is also some not so good, I wouldn't say bad information, but not so good information. So please look at references. Do not use ChatGPT for everything you want to look for. Go for evidence, go for what is scientifically proven, and go for the good information to train and give yourself the best chance of succeeding in your work. So with these few words, I would like to stop here. And if there is any question, I would very gladly take them. Thank you very much indeed.
Thank you, Doctor. Do we have any questions from the participants in the audience? Again, you can also put your questions in the Q&A.
You can also put your question in the chat.
Yes, yeah.
Thank you, Judith.
Mhm.
I'm reading your chat. And Remy, of course, we have been chatting for so long on this subject. So good young people coming. This is what I call, I say this, I work a lot with the African Union. I say you are the next generation. And my work has been mostly in Africa, but also to a certain extent in the Middle East. So I know the African scene quite well. And I see you guys. Abaneh, I don't know whether you are a Ghanaian or a Nigerian or Ethiopian, because your name is a combination of both.
Yes, actually, I'm Cameroonian.
Cameroonian, okay.
Yes.
So you are the faces of this next generation. I can see the face of Rukaya here. So all the best to you. And if you have any question at the end, I'll be happy to take them. Thank you.
Okay, thank you, Dr. Abdool. All right, we will go ahead and move on to our next presenter. I am honored to present Dr. Berda. Dr. Berda is currently an independent nursing educational consultant. She has collaborated on presentations and projects with the International Bureau of Narcotics and Law Enforcement Affairs, the World Health Organization, the United Nations, and the International Nurses Society on Addiction. On curricula for professional health disciplines, Dr. Berda has also served on the INT-NSA board for 7 years. She was previously an associate professor and director of the Doctor of Nursing Practice program in the Psychiatric Mental Health Nurse Practitioner specialty at the University of Maryland, Baltimore, in the School of Nursing in the United States from 2012 to 2023. She retired from her faculty duties after 23 years. She has developed specialty curriculum at the BSN level or the bachelor's level, the master's, and the doctoral levels, both nationally and internationally. Her academic focus is educating nurses on the care and treatment of individuals with mental health and substance use disorders. Dr. Berta is a board-certified psychiatric nurse practitioner, a psychotherapist, and an autonomous prescriber and teacher. Most recently, in 2024, she co-developed a global nursing curriculum in addition. This was funded work by the United States Bureau of International Narcotics and Law Enforcement Affairs. It is anticipated that following the June 2024 pilot in Greece, it will become a globally certified addictions nurse course in 2025. I would love to welcome Dr. Berta. Thanks.
Thank you very much. Am I sharing?
No.
No. All right, here we go. We're going to do this again. I'm going to pull this up. Oh, I see what happens. Share is not available. Here we go. I know a lot of things, but technology isn't one. Dr. Abdool, I'm so glad that I'm following you because you were the perfect setup for what I want to present. And you made me think so many different things. One thing I want to say about Africa and hearing how much marijuana there is going on. One of the things that I've had with my patients that I stress very much is that the secondhand smoke from cannabis is oftentimes in the homes where children are sleeping. And it is one of my advocacies is to get parents to realize that if they put their children to bed and then start smoking cannabis, oftentimes the children are breathing that cannabis in their sleep. And it is a major concern for our sleeping children. So please keep that in mind. And when you're educating your patients, it's something to bring up. Many of them don't even think about that. But it comes up often in my patient care. All right, so here we go with my slides. Dr. Carmel Clancy, who is unfortunately not able to come with us today, I'm going to do her slides as well. She and I were approached to create a curriculum for universal nursing in addiction. And we were very pleased to do so. We completed level 1 of this program and curriculum, and we did do a pilot in June of this year in Thessalonica, Greece. We had 14 participants, all nurses, and they came from 9 different countries. We wanted to make sure that we were being inclusive of everyone and broadening our scope. So we did include everybody in terms of their different ways of processing as nurses. It's been an amazingly stimulating project. The curriculum is now going to the United Nations for approval. It'll come back to us again for edits. And then once it is accepted by the UN and the World Health Organization as a valid curriculum, it'll have open access on the ISUP website. I hope you're familiar with ISUP. It is the International Society of Substance Use Professionals, and there is a lot of information and courses that you can take there. This curriculum is specifically for nurses, and I'm going to tell you why as we go through and how this grew. But you would have to get all of the medical background, which is available on the ISUP website. If you join ISUP, you're joining like 220 different countries. They have really positive kinds of workshops. It's all free. Joining is free, and all of the access to all of the information is also free. So please check out the ISSUP, International Society of Substance Use Professionals. I agree with Dr. Abdool, you can't do this alone. You have to really educate yourself. This is one way to do it. And it even gets bigger than that. So let's see. Nurses are touched by all of us throughout our lifespan, but most especially at birth and death. There's a nurse in every room. I think very few people get out of not being touched by a nurse at some point in their life. And there are roughly 29 million of us globally. All the more reason why we should have our eyes on the patient, exploring the holistic presentation that we're seeing, not just the primary reason that they're coming to us, but looking at every aspect. I've seen, nurses take care of wounds, abscesses, all of the things that happen with IV drug use, and never once touch the topic of where it's coming from, never going upstream. And we're losing our eyes and our hearts and our hands and our knowledge base by not being able to look at the full presentation and be able to comment and to be able to find the education and the prevention, all of the things that we just heard about. So nurses are half of the global healthcare workforce globally. Wrap your head around that. That is a lot of us. We are gatekeepers. We see who's coming to us. And if we just focus on the one little thing that brings them in, we're missing huge opportunities. In many countries, in my country, in the US, nurses are always voted as the most trusted professional group. We have multiple ways of working all of our roles. We have multiple levels of education, and we need to find our spot and be able to work. We provide 80% of all hands-on care continually under the direction of physicians, but we are there with the patient for most of the time. And a lot of this information and more is from the International Council of Nurses on their Nurse Day 2023, Our Nurses, Our Future. So if you're not familiar with ICN, I would say check them out. There's a lot of information there for you also. Dr. Remy went through this a little bit with you, but the enormity of the issue of substance use is overwhelming. It is overwhelming. In the 296 million people, 5.8% of the global population between the ages of 15 and 64 had used illicit drugs in the past 12 months when this survey was done. 5.8% of our entire population is a lot of people. That doesn't mean they have a substance use disorder, but it does mean we need to be looking at why and looking at the prevention. People using injectable drugs, 3.2 million in 2021, which was an 18% increase from 2020 when we were going through the pandemic. So during the pandemic, one can understand the coping mechanisms required during that difficult time, but the following year it was still growing. And globally, opioids is the primary focus because of the severe consequences and early death. So here we are. Our world is very small, and we have the UN and the World Health Organization with their Sustainable Development Goals giving us the ideals, like the dream of our future: no poverty, zero hunger, good health and well-being. the executive for Sustainable Development Goals points to nurses. We are the reason, we are part of the way of getting down this road to an ideal. And we are all somewhere on the continuum. There isn't any country or place where this is all happening. But this is an ideal for us to look forward to, and to see that wherever our countries are, wherever our institution is, wherever our agency or clinic is, that there is an ideal there that we can work towards. And Remy spoke to equity and inclusion, and that's also a part. Gender equality. We need as a workforce to keep these goals in mind and know that we're working towards something much bigger than ourselves. Trying to advance here. So what we say is, and I don't know why I'm not advancing. I'm on a little tiny computer because mine is in the shop. So it's not working the way that I used to. So let's see. So what we say is every nurse is an addictions nurse. Every nurse should be playing a part in finding what the real issues are in an individual that keeps them coming back and needing care. For all the countries to reach the Sustainable Development Goals on health and well-being, the World Health Organization acknowledges that nurses play a critical role in health promotion, disease prevention, and delivering primary and community care. We're in every emergency setting, and we are key to the achievement of universal health coverage. I know you don't think of yourself that way. And why is that? We think it's this: the identified individual issues and systems barriers that keep nurses in this place of not knowing or not feeling comfortable is that it's not taught in schools. It's not taught in the nursing schools. You might have a lecture in psych. You might have a lecture in pharm, and that's it. And the medical schools aren't far behind us. It's just not an issue. But that was then. And now we have a pandemic. And now we have many of our citizens in our countries who aren't functioning because of this. And it needs to be addressed. So when substance use care and treatment is not taught, one of the issues is role advocacy. And the nurses are going to say, like, I have no knowledge or skill sets in how to do this. I can ask a question, but what do I do with the answer? Where do I send them in my system? We feel like we have no job legitimacy. It's not my job to ask about substance use. It's not my job. I don't know what to do with the answers. I don't know how to process that. My job in my institution might be to call the social worker or to get a substance use counselor in. What if there's no place to refer to? That's a systems issue. I have no referral. I don't know how to ask these questions. Where's my role support? My healthcare system does not see substance use disorder in my scope of practice. So they're not going to support me. They're telling me what I can do. And this isn't part of my system of care and what's expected of me. And these are real barriers. And the ones that we are using, role advocacy, role legitimacy, and role support as being the barriers to having nurses do ask the questions and do follow up with the screening. And it's what we're teaching in our course. Is again, very specific nursing course, not a medical course. And you need to have both, as we'll see. Oh, I'm just gonna have to do a different way of doing this here. Let's see. So what we teach in the nursing model is, the first module is the holistic nurse, embracing addiction care in every setting. No door is the wrong door. every place that a person comes in through the healthcare system, whether it's the ICU or emergency care or the clinic, or just for a checkup, a health checkup, should be the right door to have a professional asking them what brings them here? How do they cope? What do they do in stressful situations? The next is basic nursing practice in addictions. The next is building therapeutic relations, nursing engagement, trauma-informed care. We now know that many of the people who are using drugs have a history of trauma that has not been addressed. So we're teaching those skills also. So these are 5 modules that are taught over a 3-day or 5-day span of time. The requirement is 3 days, but it can be extended to 5 days because there are several countries who don't get government funding or support if they're less than 5 days. So we've given alternative things to do on the 2 days so that our program will work and it will get out to nurses. So these are the first 3 modules. The next are expanding nursing roles and responsibilities. We're teaching screening, brief intervention, and referral to treatment. We're also teaching the World Health Organization screening called the ASSIST that Dr. Abdool told us about earlier. And then we're looking at integrating all of the learning into practice. And that includes all of the ethics, all of the leadership, self-care, burnout, individualized professional plans for yourselves. It's helping you to see nursing as being vital to working with this vulnerable population and giving you the resources that you need to feel comfortable doing it. And that's great on an individual basis, but then we need nurse leaders to talk to the systems in which they work to make this part of the scope of practice so that they see that we need nurses' involvement, not as the counselor, not as the physician, not as the psychologist. Those are usually the people that are listed in all of the other in-services that are given. Nursing is always, often, I would say most of the time, omitted from those. It's the physicians, psychologists, addiction counselors, not nurses. So we need to be part of that treatment plan because we bring a lot to it. So we try to do a little bit of leadership. So we're growing this. It's a big picture. It's kind of like the ideal that we have for our sustainable goals, global goals. Now we have this model. So there's a level 2 that is under development now. And we're moving into ICU DDR. One of the issues about teaching about addictions in nursing schools is there's not faculty. There aren't faculty in academia with substance use experience that can teach the courses or that want to teach the courses. And there's a lot of resistance because the curriculums in nursing schools are already so packed that they don't see room to add it. So the International Consortium of Universities for Drug Demand Reduction is supporting maybe utilizing the coursework that we're doing and also the other ISAP information in courses and training trainers to do these short side courses for the universities themselves, a Center for Educational Development. They have these centers already set up. We want to add nursing. Center for Educational Development to design and develop academic programs, to infuse the curriculum, to train faculty and staff, to provide courses on the latest science in substance use prevention, treatment, and recovery. This is also a very growing knowledge base. So You can't use information from long ago. It's constantly changing and being updated. It's really important to stay updated. Don't use old information. You can use a lot of the latest and greatest, which I've been giving you, many of the professional groups have SIGs, special interest groups with addiction, and they are often really good and solid. Don't go back and use old textbooks. Don't go back and use old things, because they're not going to give you the right information. Center for Research encourages and stimulates research in this whole area. There's a lot of research that's going to be coming out of the work that we're doing, and mentoring researchers to look. Actually, there's a lot of money going into research, but there's not a lot of experienced addictionologists in that research all the time, oftentimes, or very limited. You know, we're all limited to what we've experienced and done in the way that we work. So the Centers for Systems Change is also strategic work with policymakers, technical assistance, and promoting technology and transfer, design and implement workforce development strategies. I had a lot of grants that were workforce development grants in the United States. Promote policy changes to ensure an effective substance use prevention, treatment, and recovery systems. And then here's the big one that's for us, the Global Center for Credentialing and Certification. We need people who are certified and credentialed to take care of this population. Everybody at the gate should have some knowledge about addictions, but we also need in the treatment centers people who are credentialed and certified, that they have the education to actually do the work within their role in their scope of practice as designated by your country or your agency, always working in tandem. Again, Dr. Abdool's wise words, don't do this on your own. Get a posse, start working together and see what you can do to make the changes from within. So there is coming in the GCCC, Center for Credentialing and Certification, the Global Center for Credentialing is part of Dr. Clancy's work now. It's providing an ICAP credential. It's not just beneficial, it's transformative to show up and say, we're nurses, we have credentialing in this arena, we want to be a part of it. So for professional nurses, it's a gateway to career growth and global recognition. For employers, it's a guarantee of quality and efficacy, so that what they're providing in care and treatment is the right care and treatment. It's evidence-based practice. It's coming straight out of you taking the exam and showing that you know how to do this. For governments, it's a powerful tool in combating addiction, improving public health, and aligning with the international development goals. That's why it's a big picture. And again, we're trying to give you bite-sized pieces of why it's so essential. Those of us in the field know why, but we're trying to hook you here and say, we need more. We need more. So we have these little, if you come to the ISAP has big conferences. The next one is in September of 2025 in Bali. Might be worth a little jaunt if you want to check out Bali and get in with their conferences. But most importantly, get on their free website and free membership. So in GCCC, over 2,241 professionals have been credentialed in 80 different countries so far. What we're trying to do now is to get the governments to recognize the importance of this. In my mind, and here's my little radical statement. It is a form of stigma not to have qualified professionals in every treatment center and in every place people come for care and treatment, not to have the referrals available, and not to have the professionals knowledgeable and using evidence-based practices to care for this population of people. To ensure the highest global standards in prevention, treatment, and recovery of substance use disorders through rigorous experience, practice verification, and comprehensive certification exams, GCCC empowers governments, healthcare providers, and employers to select the most qualified professionals. This commitment to excellence drives improved outcomes for individuals, families, and communities worldwide, and fosters healthier societies and stronger, more resilient systems of care. We've all seen less than. We know we can do better in every arena. And these are the ways to do it and the people to be working with. Structure and governance purpose. Develop standards of requisite knowledge, skills, and experience mapped to competency frameworks in substance use disorder, prevention, treatment, and recovery support. Provide evaluation mechanisms for measuring and monitoring the level of knowledge, skills, and experience required for GCCC ICAP credentialing and/or certification programs. Establish policy and guidelines for acquiring and maintaining credentials and certifications in accordance with non-discrimination regulations regarding race, creed, religion, sex, age, ethnic background, and any other pertinent guidelines set by GCCC Commission. Ensure that credentials remain fit for purpose and are proactively future-proofed to meet the evolving needs of the workforce. So staying up on it. This is hard and tedious work, as you can see. And because these are big funded organizations, the promise is that they will continue. Here's ICAP qualifications. There are multiple kinds for each level and the support. The cost of the exams is being worked on because we know that cost can be a barrier. We're trying to take care of all of the barriers. You see that there's supervised work experience that's required. Supervised work experience. There's training hours that are required. There's minimal educational levels that are required. And then for prevention, treatment, and recovery support. And these are updated. The ICAP exam is pending for 2025. And a lot of it has to do with, we've already developed the exam, but a lot of the timing requires the UN and WHO to approve the curriculum as it stands. And then there'll be a rollout. Some people may already have the training hours, the supervised work experience, and the education. So they would just take the 3-day course and take the exam. There is an online portal that's easy, accessible, and guides candidates step by step in the process of joining ISIP Global Network, take the courses, document the work experience, submit the application, and then take the exam. We're trying to streamline things, but don't streamline your education. And then Dr. Clancy, who is the director of the International Consortium of Universities for Drug Demand Reduction, says thank you. And I thank you for your attention. And I think we're all going to stick around for questions if you have none, but hopefully this stimulates and excites you, because we have heard, you know, that many of you need a little bit more than you've had in the past. So, thank you.
Thank you, Dr. Berta. Actually, I personally have a question. So if you're not a specific psych nurse, like if that's not your specialty, do you think it's still worth getting certified with the prevention course, through taking the ICAP prevention exam? Because we do come in contact with many people, all sorts of people with all sorts of issues, that we see every day as nurses. What are your thoughts on that?
Every nurse is an addictions nurse. So every nurse should know something about addiction. Every nurse. So you need to have some experience working with, you don't need experience to take the 3-day course. You need to take the 3-day course, and you need to do some medical background. You know, update your medical background through the ICEP medical courses. There's a foundational addiction course that's excellent. And then you can look at the qualifications will all come out. But every nurse, yes, psych nurses get a little bit more in addiction. They don't get a lot. They get a little more because we have so many co-occurring disorders, which is, you know, the mental health and addiction seem to go hand in hand for most because of the coping mechanisms. I know somebody had a question about the model of conditioning. Conditioning is a learned behavior. So when you're learning how to cope, when you're learning how to take care of the nervous system, in a lot of families or groups, they do it by drinking alcohol or smoking marijuana or using substances to calm down. So the nervous system is actually, it is calmed down using those substances. And conditioning learning is that. It's learning by watching or learning by what you see. Your environment is part of that conditioning. That's a really short, down and dirty example.
Thank you, Dr. Berta.
Yeah, thank you.
All right, our last presentation is from Dr. Adejumo. So I've already presented her, so she can go ahead. Thank you.
Okay, thank you so much again. Can you hear me? Can you all hear me?
Yes.
Oh, okay, great. So the last presentation is going to be on, we discussed about so many things today so far. We discussed about what nurses can do to influence the change in addictions or drug demand reductions. I just want to give you an example of what a nurse did. And that example is what we did in Nigeria. That was a nurse-led project. So what happened was that I went to Nigeria, I think it was in 2018, and I just want to bring, give you a little summary of this for leadership aspect. Though that we should never think because, I'm not an addiction specialist, I'm not this, I'm not that, and limit ourselves on what we can do, what we're capable of doing. I see myself as a nurse, but I have a lot of friends across the globe. I see myself as a nurse that worked in the ED, that worked in the ICU, but I see myself also having friends that if I need help, I don't have it alone. I have Dr. Butler there, I have Dr. Clancy there, and I have Abaneh there, in my specialty as a gestational diabetes person that looks into women with pregnancy. And I have another person, Dr. Fonelli, who is my mentor. I have all people that are experts in addiction training, or that they know about addiction that I can run to if I have questions. So at this particular time, I was in Nigeria in 2018, and I saw a big problem that was, I went everywhere, and I'm seeing young kids that have addiction problems. I came back to the US and spoke with my mentor at the time, Dr. Fonelli, and I asked her, what can I do? What can you help? This is the problem here. And she says, you know what? I said, can you help start a program in Nigeria? So with some of them are online here, Ms. Ogumbiyi, Mr. Ogumbono, and a lot of them came from who are in Nigeria. They stood up. They are specialists. They have a psychiatric, mental health psychiatric specialists, nurses, and I consulted them, and we started a program, which is the ENSA Nigeria chapter. But then that wasn't just it all. I was looking into why, because I know based on literature and based on evidence that I have, understanding that relationship between substance use and medical complications is real and it's very, very challenging, especially in communities where the money or poverty level is really extensive, or where individuals have to pay 100% at the point of care. Why not take care of the problem before it becomes an extensive problem that is not manageable? The things killing a lot of individuals with substance use disorder is not the infection itself, it's the non-communicable.
We will take some.
Are the non-communicable diseases that are associated with, which are the complications of substance use disorder themselves. So we have patients with substance use disorder actually have 20.38 years potential life loss compared to the general population. That's huge. The average life expectancy among them is about 57%. A lot of them deal with physical health, not just the behavioral health. They deal with physical health like diabetes, cardiovascular diseases, and other somatic health issues. So what can a nurse leader do? And that was exactly what we did in Nigeria. So this aspect of the presentation is just to demonstrate an exemplar of a nursing leadership action to prevent diabetes, which is just a little a percentage of people with substance use disorder, but it can help at a great deal. So I want us to know that no matter how much we can offer, a little is better than nothing. We know that alcohol is a problem across the globe. We also know that some countries, some substances are acceptable by the society. That in the tradition, like alcohol is acceptable in some places. Not that it's good, but we have a lot, like in Nigeria now, a lot of men, they drink a lot of alcohol, they consume a lot. We know that cigarette smoking is also an issue, and is one of the substances that we want to try to reduce, to mitigate. So we, in a study that reviewed harmful use of alcohol, for example, in Nigeria, we have this systematic review had like 35 studies with 37 Nigerians in 6 geopolitical, we only have 6 geopolitical zones. You can see how many women, how many men in the urban area. In the rural area that we're thinking, most of them are not drinking. Look at how many and the percentage of women in the rural area of Nigeria drinking alcohol. So we have a problem that needs to be addressed. And if we do not address this on time, we'll have issues. We'll have issues with the generations, the next generation. So we need to do something. As I discussed in the last presentation, there's so many negative impacts of substance use disorder. You can see what it is with alcohol use disorder. It's unemployment with it. A lot of individuals, when the government sees them, especially with cannabis use or cocaine use, or even just having those substances at hand, they can be imprisoned. It leads to job loss. In some cases, it leads to poverty. Socioeconomic status becomes a problem. Now, what can we do as nurses? So what we did as an exemplar, we saw that diabetes is a huge problem in Nigeria. Average Nigerians are genetically predisposed to type 2 diabetes from birth due to our genetic predispositions. And we know that substance use disorder, it's a problem. It's a prevalent problem in Nigeria. In fact, if you look at the 2020 UNODC report, it says Nigeria has the highest prevalence of cannabis use compared to any country all over the world. This is a problem. So what we did was that we, at an institution, we knowing the pathophysiology, which is what we learn in the nursing school about the relationship between substance use disorder and some somatic conditions, that led or possibly could be are the causes of the shorter life expectancies among these patients. We decided to, to start a little bit at a time and see what we can find. So we started with 28 patients, and we wanted to institute diabetes prevention program among them. So what we did was that we recruited about 58 patients, or no, I think about 50, but we ended up altogether having 28 patients. Of the 28 patients that we recruited in the essence of time into diabetes prevention program, we realized that majority of them, in fact, 100% of the 28 people that we had in the program had indicated that they've used cannabis, and 100% of them also indicated that they've smoked. But and then some of them indicated that they drink alcohol. So we did a whole year diabetes prevention program on them. The outcomes were that they have to self-report at the baseline what they use, and then at baseline, I mean, every session we had like 26 sessions. And what diabetes prevention program constitutes is encouraging them to improve their physical activities and encouraging them to also improve their, I know a lot of them says, oh, there's no money in Nigeria, but we still encourage them to do portion control. Of the 28 patients that we had, as you can see on this chart, we had average weight pre the lifestyle intervention, we have 73.2 as kilogram as the average weight of the individuals, the participants in there, and the average BMI was 25. But post-intervention, we had reductions in weight, and also we had reductions in BMI. This is very significant for us because we know that if we can reduce, because this is the only evidence we have, only study we have that is evidence-based, it's a 3-decade evidence-based study that shows that patients, even though it has not been proven with patients with substance use disorder, this is the first of the study in Nigeria that was done all over the globe about patients with substance use disorder with integrated diabetes prevention program. What we found with this study was that some of the patients, we had significance with alcohol intake, but we have marginal significance with cigarette smoking, but we did not see any significance in cannabis use. So we've taken it to the next level. Instead of 28, we want the sample size to be higher. So we're currently implementing the second stage or the second phase of the program with 360 patients. And also with this one, instead of just relying on self-reported outcomes, where we have blood work to compare to, to show that, to confirm what we're seeing. And the reason why I'm bringing this up is that a lot of us, we say, oh, I'm not an addiction specialist, how can I help? It's a lot of ways you as a nurse leader can find, things to do around your area. Other than the fact that this is helping to improve both behavioral and physical health outcomes, the participants in these programs were used as peer educators that are helping themselves. So it's a sort of employment in a country where employment is so bad. We can use this program as a nurse-led employment improvement in your nations. We can use it as a nurse-led physical health improvement in our nations. We can use this as a nurse-led behavioral health outcomes improvement in our nations. When you think of all together, when Dr. Abaneh referred to the SDGs, which is like the 3.4 SDGs and 3.5, one is the health outcome for substance use disorder or addiction improvement, and then the other one is the physical health, SDG 3.4 and 3.5. It can be used to improve that. As many as the nations in the African nations, a lot of the nations are still yet to meet these SDGs metrics. There are so many things nurses can do to help achieve them. So I'm encouraging us to not just be limited by what we know. You also remember that you have a lot of nurses as friends. You have a lot of nurses as colleagues. Let us come together and collaborate with each other and using the knowledge that we all are experts in developing and improving the health outcomes of our society, of our community, and the global health at large. So thank you for your being here, and I appreciate your time and being here with us today. We'll have more of this in the future, and then the other results that we have coming up soon, we'll be sharing it in many in different areas or different forums. Thank you. That's it for me.
Thank you, Dr. Adejumo. We want to open up the floor for any questions. You can either use the chat, Q&A, or you can come off of mute. Just raise your hand. Okay, we have a couple of questions in the chat. So we have Mike Chinyanga. The other drug which we are not talking about is /R GMO that are affecting our health. Okay. You have any comments for that? I think if you don't mind, GMO in terms of chemicals, I'm not sure if it's actually considered a drug. I don't know. What are your thoughts? It is harming our health, but what are your thoughts, presenters?
Dr. Abdool or Dr. Clancy are experts, so either of them can help us with this area.
Thank you. I have not seen any definition whereby a GMO would qualify as a drug,
Okay.
licit or illicit. So this is my position. Thank you.
Thank you. Okay. Thank you, Dr. Abdool. We have another question from Rukaya. I don't know, Akaredi. Honestly, cannabis is the hardest substance to quit when talking about addiction. A lot of clients will say they crave cannabis more. May I ask, Rukaya, where are you from? What country? Well, I do know that in the United States, cannabis has been legalized recently. So it's something that we're seeing more and more. Do you guys have any thoughts on the effects of cannabis versus other drugs? Like, are there any thoughts on that?
Well, as you know, the potency of THC in the cannabis has been going up and up and up. And therefore, as a result, it is more and more addictive to the user, simply because the THC content is very high. So that could be a reason, though we also know that from the African Union studies we have conducted in 33 countries, cannabis is the #1 drug of abuse, as well as accounting for the largest number of people for treatment demand for any type of drug. So cannabis is very high on the agenda in Africa. My area of work is mostly in Africa, so I can speak confidently about this. Thank you.
We also know that the respiratory effects of cannabis over time. I mean, they're still taking in a lot of smoke. There's a lot of different additives that you don't have identified. There's not a lot of scrutiny over what's in the product. So that's an issue. Driving is an issue. Accidents is an issue. Young children getting high. In the States, we have gummies that look like little candies. That's an issue. Children eating a lot of gummies or having the food and then winding up in the ER because nobody knows what to do and just having to wait through. There's a lot we don't know about this high potency stuff. It's not, it does affect your health. And it can, jury's out because it's of the potency.
All right, there's another question about how do we categorize the influx of high sugar content drinks in our system, which I suspect contributes to the increasing incidence of diabetes. So, good point. One of the criteria we encourage in diabetes prevention program is for the participants to replace and every day to inform us how often they replace sugar sweetened beverages with water. And I believe, I'm suspecting that because of that intentionality to reduce the content, sugar sweetened beverages, perhaps that's the reason why we have a significant reduction in alcohol use compared to the rest of the substances we had in the first group of diabetes prevention program. And then there's a question, we're trying to do away with drugs from the community, but we forget those who are selling them. What can we say about these people? The question is, what can we say about these people? Our role as nurses is to educate our patients at every level. Pediatric level, adult level, all adult care. It doesn't have to be in the psychiatric before they come to the behavioral health. We need to educate, informed. If a patient is informed about the consequences of this and how these drugs take over their system, their body, their completely mental state, but perhaps a lot of patients, because you remember there was one of the models, it says educational model. Perhaps most of the patients will not use anymore. Unfortunately, there are so many countries all over the globe right now that are legalizing cannabis. And they're saying that, there's no harm in cannabis. And we know that, like Dr. Abdool rightly said, that THC in cannabis use, they are genetically modified compared to the cannabis that were grown a long time ago. So educating our patients is very, very essential. And this is where the nursing role will stand. And then we're trying to, okay.
If I may, Joseph, in this forum, we are talking about drug demand reduction. And we have to do, therefore, a lot of prevention to reduce the demand. But at the same time, your questions is particularly relevant for the law enforcement and interdiction group that they have to make sure that the minimum amount of any type of drug gets to the market. So there is that much that you can do. You have also to protect yourself, because in some countries, those who are behind the drug sale can be very, very violent as well. So I would say that reduce the demand, do prevention, and people make the right choices, while law enforcement can do their work, reducing that these drugs get to the market. Thank you.
I also wanted to just chime in. Asabiga, I don't know if I said that correctly. I really appreciate your question, because I do agree that sugar should be categorized as a substance that's very addictive. However, because sugar is something that our body needs, and it's just more so how much of it, that's, I believe, why it has not been categorized as something that is addictive and that could affect our health. And that is why I feel like we see such an epidemic with diabetes. Okay. Any other questions?
Somebody is speaking, but we cannot hear him or her.
I think they might have came off mute by accident.
Oh.
Mm-hmm. Okay.
So thank you so much for all coming because we already exceeded the time. We only have 90 minutes for this presentation. And it's nice and very joyfully that, we all come together to discuss about how we can help, how we can improve our societies and communities. Thank you so much. You will be getting, based on the information provided to me by the host, you should be getting the recording of this presentation will be emailed to you by the host. Thank you so much for coming, and I really appreciate the contributions here.
Thank you.
Thank
Thank
you.
you.
Thank you.
Mhm.
Thank you very much for this wonderful webinar and for what you have shared with us. I would like to encourage participants who are not AfriHealth members to join AfriHealth. You can join via the membership portal on our website. Thank you very much and have a wonderful day. Bye-bye.
Thank
Bye.
you.
Bye-bye.
Mhm.
Bye-bye.